Good morning. Infertility is a scary word for a lot of women, but there's lots of help out there. Claudia tells us about one condition that could be affecting you if you're trying to conceive.
Hey ladies, today we're out at the Advanced Fertility Center and we're talking about one of the leading causes in infertility, PCOS, polycystic ovarian syndrome. And with me is Dr. Joe Garza today. How are you, doctor?
Fine, thank you. Good morning.
Good morning to you. Now I want you to answer a few questions because this is a big deal for women. What is PCOS?
Well, polycystic ovaries are a condition where a lady has more than the normal amount of small cysts or follicles on her ovary. You should always have a few, but if there's more than 5 or 6, then that's sort of an indication that she's not ovulating. She probably doesn't have regular periods and may even have some problems with her complexion, but more importantly, she's not getting pregnant when she wants to.
I see. And how does this affect fertility?
Well, normally the cysts that we see are follicles, and in each follicle there's an egg, and it should grow in about 14 days and pop, and the egg goes into the tube. Well, if that's not happening, then the eggs mature for a little while and then stop, and they sort of stack up like a traffic jam on 410.
Doctor, at what point do you realize a woman has polycystic ovarian syndrome?
Well, we see some young ladies in their teens because they have complexion problems and irregular cycles. But later on, when they're ready to start their family, they're off the birth control pills and the irregular cycles return and they're just not getting pregnant. That's when we start evaluating her for polycystic ovaries.
So I'm sure you see a lot of women who are frustrated because they can't seem to conceive. In most of these cases, is PCOS the cause of it?
In most cases, it seems to be. And then luckily, there's medication that we can help induce ovulation. Sometimes they even have to take a medication that diabetics take. Not that they're diabetic. It seems to help the eggs mature and be ready to release.
And I'm sure in this day and age, there's something that can be done for women who have this condition. Tell me a little bit about that.
Yeah, absolutely. Well, first you do the generic hormonal evaluations, confirm they have polycystic ovaries, and a lot of times on a sonogram you pick up extra follicles. You should see 2 or 3, but if there's a whole series of them, like on this ovary, then that gives you a high degree of suspicion that they have polycystic ovaries. If weight is a problem, reduce their weight to their, closer to the ideal BMI. Perhaps start on the diabetic medication to help their eggs mature. And if that doesn't work, then talk about an ovulation-inducing medication like Clomid or Femara to help them mature follicle, mature the egg, pop the egg, and hopefully achieve a fertilization.
How do we find out if we have PCOS and who gets it?
Well, it seems to be genetic, so it's not like you acquire it in some way. But if you're having irregular cycles, if you're not getting pregnant, if you have complexion problems or more facial hair or acne later on after puberty, then you should be highly suspicious. And then at that point, do the evaluation, do the hormone test, maybe a sonogram, and then decide where you go from there.
Okay, and for women who haven't been tested for it but may be concerned, what is that first office visit like? Because I know it can be scary.
The most important thing is their history. What has happened before? Did they start with irregular cycles? Did the complexion problems occur? Are they concerned about their complexion or pregnancy or both, and then go from there?
Now, this isn't the end of the world for women who want to have babies.
No, absolutely not. And the great thing about it is you really don't need any surgery. You probably need some education, maybe some weight loss, and then some medication.
Thank you, doctor. Ladies, it's so important that you get informed. PCOS is very much alive, and it could be affecting you. So if you haven't conceived and you're trying to, there may be something wrong, but don't be afraid to find out. Talk to Dr. Garza because there's always options available for you.
Thank you, Claudia. And if you would like more information, the Advanced Fertility Center is on Hardy Oak Boulevard, Suite 500. They are so wonderful there. The phone number is 616-0680. AdvancedFertilityCenter.org is the website.